Remember that case study from your NURS 101 notes? The one where, the nurse noticed patients were getting bed sores with a certain type of mattress.
Oh, right, right.
She thought something's not right here, dug into the research, advocated for a change. Fewer bed sores, happier patients. That's evidence-based practice, right?
Yeah, that's EBP in action.
And that's what we're diving into today. How you can use research to really make a difference.
It's not just about, memorizing textbooks or anything. It's about, how do I put it? Bridging that gap, between the books and what you actually do at the bedside.
So, ditching the jargon, what does EBP actually look like day to day for a new nurse?
I think of it almost like, a mindset, like a constant curiosity about how to provide the best possible care.
Okay, so always questioning.
Yeah. Your notes call it the spirit of inquiry, and it really is so important throughout your career.
So, more than just following the rules, it's about, like, why are we doing this way? Is there a better way?
Exactly. Always looking at the research and ask, what if? That's EBP.
And your notes really emphasize how that leads to better outcomes, which is what we all want. But it's
Oh.
also about you, the nurse, feeling confident, right?
Absolutely. Knowing you're using the latest and greatest, not second guessing, that confidence helps you interact with doctors, advocate for your patients.
It's like having that extra knowledge that makes you a better advocate.
Yes. And speaking of knowledge, how do we even know what the best evidence I is? Your notes talk about the scientific method, good old observation, and all that.
Yeah, but how does that apply to something as complex as, nursing and caring for people?
That's what's so cool about it. The scientific method helps us study those complexities, minimize bias, and provide really effective care.
Because we all come in with our own biases, right?
Absolutely. We rely on what's called empirical data, those observations, measurements. That's what helps us understand what's really going on.
So it's not just about crunching numbers, it's about connecting those numbers to the actual patient.
Exactly. And that's where the nursing process itself becomes an EBP tool.
Oh, interesting.
Yeah. So assessment, diagnosis, planning, implementing, evaluation, every step you're using evidence. You're adjusting based on what you're seeing.
Like detective work almost.
Yeah, you can say that. It's
Yeah.
like detective work, right? Piecing together the clues to figure out what will help your patient thrive.
And speaking of detective work, let's talk about infection control. 1 in 31 hospital patients has a healthcare associated infection on any given day.
Wow, that's a lot. It really shows that even in a place for healing, there are still risks.
Big time. So, how do we tackle these infections? We've got to think like investigators ourselves.
Right. Your notes mention the chain of infection, which is a good place to start. Basically, it's like a series of events that have to happen for an infection to actually spread.
So, break it down. What are those links in the chain?
Well, first you have to have the infectious agent itself. Yeah. The bacteria, viruses.
The bad guys.
Right, exactly. Then there's the reservoir, where they like to live and multiply.
Which could be what, like a person or?
A person, an object, even water. Basically anywhere those germs can hang out.
Okay, so the germ's got its hideout. Then what?
Then there's how it gets out, the portal of exit, then how it travels, the mode of transmission.
And then how it gets into a new host, the portal of entry.
You got it. Which brings us to the susceptible host, the final link.
And that's where our immune system comes in, right? Some people's are just weaker than others.
Exactly. Your age, your health conditions, even medical treatments can make someone more susceptible. It's like a weak spot in your armor.
So these pathogens, they're opportunistic. They'll take any opening they can find.
Exactly. And speaking of which, your notes go into all the different types of pathogens, but maybe it'd be helpful to focus on a few key ones. First up, bacteria.
They're everywhere, right?
Everywhere. And while most are harmless, some are, not so much. Think staph infections.
Staph, those can be nasty.
Yeah, definitely. Then you've got viruses. Those are sneaky. They like to hijack your cells to replicate.
It's like they're freeloading A&D wreaking havoc at the same time. What
Yeah.
about fungi and parasites? Those are pathogens too, right?
Oh, for sure. Fungi, they cause things like yeast infections.
Yeah.
And parasites, well, they like to set up shop in the body, and they are not easy to get rid of.
Okay, so we've got all these different bad guys to worry about, but no matter what type of pathogen we're dealing with, the key takeaway is we got to understand how they work so we can treat them, right?
Absolutely. And your notes also talk about systemic versus local infections.
Right. What's the difference there again? Does it really matter?
It does. A local infection, think of it like a campfire, serious but contained. Now, a systemic infection, That's like a wildfire spreading through the body. Both need attention, but that wildfire, you need to act fast.
So systemic, basically, it's affecting the whole body, not just one spot.
Exactly. Now let's loop back to those healthcare-associated infections, the HAIs.
The ones we were talking about before, right?
Yeah, yeah. What makes those unique is that they often involve pathogens that are more resistant to antibiotics.
Which makes prevention even more important, right?
100%.
Yeah.
And that brings us to hand hygiene.
See, I told you we were circling back to detective work. It's elementary, my dear Watson. But seriously, hand hygiene, it seems so basic, but your notes really emphasize how crucial it is.
It's not just a quick rinse, it's about proper technique.
So break it down for me. What are we talking here?
Using soap and water at least 20 seconds under the nails. It all matters. And when you can't get to soap and water, you've got those alcohol-based hand sanitizers.
Right, like a little germ-fighting station in your pocket.
Exactly. But it's also about when you do it. Before touching a patient, after, before handling medications. It all adds up.
So it becomes like a reflex, like putting on your seatbelt. You just do it without thinking.
Exactly. Now, hand hygiene is part of what we call medical asepsis.
Medical asepsis.
Yeah, clean technique. But then you've got surgical asepsis, which is a whole other level.
Surgical asepsis. So what's the difference? When would you use one over the other?
Think of surgical asepsis as like creating a completely sterile environment.
Hmm.
No microorganisms at all. You're building a fortress.
Got it. So that's for surgeries, inserting catheters, stuff like that, where even a little germ could be a big problem.
You got it. And your notes actually highlight some fascinating things about maintaining a sterile field, like the role of gravity.
Now that you mention it, I remember something about not reaching across a sterile field. Why is that again?
You don't want to reach across because you risk contaminating the whole thing.
Yeah.
You're protecting that sterile zone. It's like a moat around your fortress.
So every move is critical.
It is, like a high-stakes game of operation. And moisture is another thing. That can be a breeding ground for bacteria.
Right, because it's like the walls of our fortress have been compromised. And speaking of the fortress, what about sterile gloves and gowns?
Oh, those are key for surgical asepsis. And putting on sterile gloves, it's a skill. You can't touch the outside of the glove.
Wow, so even that, it's technique-driven.
Every little detail matters. You could contaminate the whole field with one wrong move.
It's amazing how seriously nurses take patient safety. It's really incredible.
It is. And your notes also mention clinical guidelines. Those are important too.
Oh, yeah, those were helpful. So instead of starting from scratch every time, we have these guidelines with evidence-based recommendations.
Yeah, like cheat codes for best practices.
It's like having, what's the word? Like a team of experts right there in your back pocket, helping you give the best possible care.
I like that, yeah. They give you a framework, but you still need to use your judgment, your experience. Nursing isn't just about following a recipe.
And that's where that spirit of inquiry comes back in, right? Don't be afraid to like ask questions, challenge assumptions if something doesn't feel right or if you need more information.
100%. The best nurses are always learning, always asking, maybe we should try this, or I'm not sure, let me double check.
That takes confidence, though.
It does, but it comes with time, you know. Every shift, every patient, you're gaining knowledge, experience, and using it all to advocate for your patients.
And speaking of advocacy, your notes also mention reporting communicable diseases. Why is that so important for nurses, especially these days?
Because, think about it, you're the one seeing patients every day, noticing those patterns, you know, the subtle things.
Right, like those disease detectives we were talking about.
Exactly. You can catch a potential outbreak before it gets really bad. And there are a lot of diseases that have to be reported, over 60.
Seriously.
That many. Yeah, everything from, you know, measles and mumps to things like tuberculosis.
Wow, okay, so that's a big responsibility. It shows how important nurses are to public health.
For sure. By reporting what you see, you could be protecting your whole community, not just one patient.
It's amazing how something as simple as, washing your hands or noticing those early signs can make such a difference.
Exactly. Everything's connected. Every decision impacts lives.
It's a lot to think about, but in a good way. It's empowering. Everything we're learning, those EBP fundamentals, they really make a difference.
They do. Keep that spirit of inquiry. Never stop learning. You're going to be an amazing nurse.
Well said. And on that note, it's time for us to wrap up this deep dive into the world of evidence-based nursing. For all you future nurses out there, keep asking those questions, trust your gut, and never stop advocating for your patients. Until next time, stay curious and stay well.